My name is Cassi Wright, and I have been in Brookings for about 15 years now, and I currently work at First Bank and Trust. My son was about 18 months at the time, and he had an accident at daycare that caused a black eye, and it was, kind of to his face, so we were a little concerned about possible concussion or something, and then in the middle of the night he started vomiting, so we decided it was definitely time to have him checked. Well, it was about 2-3 a.m. We were greeted right away, taken back right away, saw a nurse first for kind of, the vitals and everything, and then I would say within minutes the doctor was in there. He asked me a lot of questions because, obviously he can't talk for himself. So just kind of the things that I had noticed, and then he did some different little tests, just kind of having him walk around the room, looking at how his eyes are responding, kind of seeing if he would, talk or say the few words he does know, and he was responding well to all of those, and things were looking good. So he thought that we were probably safe not, doing any super invasive testing or anything. I think everybody did a great job. They checked us in right away, and she actually just, got up from her desk and walked us right back, and then, the nurse was right there and, kind of asking me all the questions while doing, the regular temperature and everything like that. And doctor came in and kind of just confirmed some things, and then started doing his checks, and he was really explaining it kind of the whole time while he was doing it, shining the flashlight in his eyes, and he's wanting his pupils to be responding appropriately, and he was actually even kind of showing me that they were. So that was very reassuring to me, definitely. I think just, being very calm, and, they were both very kind of bubbly, lively people, made it kind of fun for him, and I think that kind of, set him at ease too. But they were using, there's like a dog house and little tree and different like stickers on the wall, and they were kind of using those, and, oh, would you go touch the tree, or, they were really creative in trying to get him to get up and move around, because he didn't really want to get off my lap, but they needed to, see him walk and do some different things. So they were really creative, using things in the room and, giving him different things to hold and see what he did with it. And when especially, he's in his pajamas in a weird place in the middle of the night, and he just, wants to sit on my lap. So it was kind of hard to convince him to walk, for sure, but they did a great job. They kind of just had this suspicion that maybe, it was just a little bit of nausea, maybe the stomach flu, something like that, because he was doing so well on, all the tests, probably just, bad timing that they both happened in the same day. So they did end up giving him like an anti-nausea medication, and kind of just watching him for a little bit. He kept it down. He started drinking water after that he was keeping down, and they said, just kind of keep an eye. And then, yeah, the next morning we found out from daycare that the stomach flu was going around his room, so they were absolutely right. I was very grateful. We live a mile away, so, it wasn't something where we needed an ambulance or, anything like that. So being able to, my husband stayed home with our other children, so we didn't have to wake them up in the middle of the night. I was here in 2 minutes and checked in, and, from the time I decided we need to come in to the time, a doctor's there evaluating him was 10-15 minutes maybe, and that's amazing. The longer that you wait, the crazier things you can dream up in your mind. So me as a mom, my anxiety, everything. We really appreciate how quickly everything can be handled here. I think it's a great place. I mean, luckily I haven't had to be here often, but when I am, you know, I always feel very taken care of, and you know, you hear about the wait times in the big cities and stuff like that, and I just can't imagine sitting there being anxious and waiting that whole time. You know, you're taken in very quickly, efficiently. You know, you see a doctor that cares and knows what to do and what to recommend, and it's amazing to be treated like that. You know, as an adult, you know, personally, as the concerned mom with their toddler, you know, it's invaluable.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.